Now we will discuss 5-HT4 agonists. 5-HT4 agonists act on 5-HT4 receptors on excitatory interneurons and increase the release of acetylcholine and thus increase GI motility. Examples of various drugs are cisapride, tegaserod, mozapride, zacopride, renzapride, etopride, and prucalopride. Among these, cisapride and tegaserod are banned as they cause QT prolongation which can lead to fatal ventricular torsades de pointes. So, cisapride and tegaserod are banned as they cause QT prolongation. Mozapride, zacopride, and renzapride also cause QT prolongation, but less commonly. Etopride and prucalopride do not cause QT prolongation. Now the cisapride and tegaserod, they were metabolized by CYP3A4. Enzyme inhibitors such as ketoconazole, erythromycin, isoniazid, omeprazole increase their levels and cause fatal torsades de pointes. Increase the level of cisapride and tegaserod and cause fatal torsades de pointes. These 5-HT4 agonists should not be combined with other drugs that cause QT prolongation, especially the one which prolong QT should not be combined with drugs Example of other drugs which cause QT prolongation are erythromycin, fluconazole, ketoconazole, ondansetron, etc. Now uses: prucalopride is the drug of choice for treatment of chronic constipation or idiopathic constipation. Which is also known as idiopathic constipation. While etopride, recent evidence suggests that it is not a 5-HT4 agonist, but it is a D2 blocker and acetylcholinesterase inhibitor. Uses are gastroparesis, and GERD. Now the next category of drugs that we will discuss is macrolides. Macrolides such as erythromycin stimulate motilin receptors on GI smooth muscle. Uses are gastroparesis, which does not respond to metoclopramide or domperidone, and small bowel dysmotility. Also known as intestinal pseudo-obstruction. Now tolerance develops to its prokinetic use. Tolerance means decreased effect with repeated use. Also, the antibiotic effect is undesirable. It can disturb the GI flora. Now, these macrolide antibiotics are implicated in congenital hypertrophic pyloric stenosis. Congenital hypertrophic pyloric stenosis, especially when given to neonates in first 2 weeks of life. So this drug is contraindicated in neonates. In congenital hypertrophic pyloric stenosis, there is hypertrophy of pyloric muscles, due to which there is, whenever we give feed to the neonate, there is vomiting. And the treatment of this condition, treatment of CHPS, congenital hypertrophic pyloric stenosis, is surgical, and it is Ramsted's pyloromyotomy. We cut the pyloric muscles. The next drug which we will discuss is loxygluomide. It is CCK1 receptor antagonist. It increases GI motility and increases gastric emptying. CCK is released from intestine in response to a meal. It delays gastric emptying. So CCK1 receptor antagonist will increase the GI motility and increase gastric emptying. Now the next category of drug is antipsychotic, that is amisulpride. It is selective D2 and D3 blocker. It acts as an antiemetic as well as prokinetic. And it is used for post-op nausea and vomiting. Side effect is hyperprolactinemia, increased prolactin levels leading to galactorrhea, amenorrhea, sexual dysfunction, hypotension, pain on infusion, hypokalemia. So these are the drugs which act as prokinetics. I hope you had a great learning experience. Also, I have a Telegram channel, Dr. Swapnil Rai Pharmacology. I urge you all to join it as I post important updates and PDF of the lectures on it. Thank you and have a nice day.